watching Your Vote on Your TV. My name is Barry Wright. Joining me now is Dylan Stelpstra. Dylan is the NDP candidate for Sarnia-Lambton. Thanks so much for taking a little bit of your time. I know It's been a busy few weeks, right?
Yeah, absolutely. Thanks for having me. It has been very busy, but it's good.
Tell us a little bit about who you are for those who don't know.
Yeah, absolutely. For those of you who don't know me, I'm Dylan Stelpstra. I'm the candidate for the NDP. I was born and raised here in Sarnia. Lived here for 33 years, other than going away to school for a little bit. I came back and I started working in the social work field. So I currently work at Children's Aid. I'm on a little bit of a leave from work based on everything that's going on, but yeah, I've been there for 10 years.
And as far as tossing your hat into the ring is concerned, was there a particular catalyst that led to that? Or
Yeah, ultimately, I actually got a call from the candidate search team. So when I was talking about running with my wife, it's a big opportunity, but secondly, I think in my time in social work, I've really seen the community and where they're hurting. And I think that our community deserves better than what they've been getting from not just this current government, but previous ones as well. And I think they deserve help in ways that they, again, just haven't been getting.
Right. And being in the social field, if you will, is that kind of the alignment with the NDP? Is that where that alignment comes from?
Yeah, absolutely. And I've seen many times and in many situations. So currently, I work with children and youth who are in care. But 75% of my caseload is sort of the 18 to 21-year-old kids who are, they're adults and they make their own decisions, but we still support them as best we can. So the amount of times that I've seen, struggles getting mental health services, and I've seen kids struggle with addiction, addiction struggles as well. And there's really just nowhere where to turn right now. And again, certainly Blue Water Health, has had the nice addition of Ryan's House, but certainly we need more than that, right? I mean, it would be great if we can get a permanent rehabilitation center, and particularly for mental health, a lot of my kids are sort of having to decide, well, do I go in and get groceries, or do I try to go to counseling and pay for a counseling appointment, right? And really, that's not a decision people should be having to make. To me, if people are struggling with their mental health, it's no different than struggling with, say, a broken arm or a sprained ankle or something like that. Those services should be more readily available for sure.
And that is part of the NDP platform, is to try to get those services sort of under the umbrella of OHIP, right?
Absolutely, yeah. So the plan certainly is to get mental health care underneath the umbrella of OHIP, again, so people don't have to decide whether they're going to get mental health services or whether they're going to pay for groceries and those things. Also currently, the wait list that we have for mental health care, wait lists are insanely long. So if we're able to put more money into it as well, wait lists are going to come way down, and those services are going to be taken care of under OHIP, which I think is going to put a lot more money in people's pockets, again, to be able to do groceries, pay their rent, pay their mortgage, whatever it is they need to do.
And as far as those wait times are concerned, can you, and I recognize each individual one is different, but Can you kind of quantify for us? Because I know one of the platforms is to try to get wait lists to 30 days or below, obviously.
Absolutely.
What are they at right now locally?
Yeah, certainly depends on the program, but we've seen wait lists, 6 to 12 months, sometimes more, kind of depending on what program kids need to get into. But it's just too long to wait, right? And the concern is if we don't take care of things up front and don't give support to children and youth up front, sometimes their struggles are compounding and they're getting much worse, right? So I certainly have had youth who have dealt with that on my caseload, and then they end up in say, the mental health inpatient at the hospital, and they're there for something that they probably didn't need to be originally, but because things have snowballed, now all of a sudden you're introducing, potential addiction concerns and some of those things, and all of a sudden now we're talking about, a week's stay in the hospital for something that maybe they just needed someone to talk to before, but they couldn't get in to talk to somebody. So I think that would be a massive shift, and absolutely a bit of a godsend for people to be able to get those services up front.
When you're going door to door, whether it be in Sarnia or Oil Springs or over, because this is a big riding, right?
Absolutely.
When you're going door to door, what are people? What's most sort of top of mind for people right now?
Yeah, so I think people are concerned about mental health and addictions, particularly in our community. So I think people are very excited to hear, oh, like that's going to be covered under OHIP, right? So that's certainly one of them. But the other thing we're hearing up front as well is healthcare. Healthcare is a big concern. We're hearing from patients, we're hearing from hospital workers, we're hearing from nurses. People forget Doug Ford made cuts to our healthcare system prior to the pandemic, and then he passed Bill 124, which caps hospital workers and nurses' wage at 1%. So when we're seeing, these estimates of where inflation is at, we're talking, 5, 6, 7%. That means that nurses and hospital staff are losing money because of this bill. And certainly, I think when Doug passed this, the pandemic hits, he certainly could have said, look, I've made a mistake. I'm going to repeal this because the pandemic has hit, but he let it sit there. And I think that's the worst because, especially in town, we're seeing a lot of signs from people about, supporting frontline workers and those things. But, our government made that bill, and I think a lot of people feel like that was an absolute slap to the face. And now we're hearing, and whether it's on commercials or through their platform, that, healthcare workers have our back. And I would vehemently disagree with that. I've heard from way too many people that are way too upset about that bill. And now we're kind of in a situation where it feels like Doug Ford is trying to buy those votes back, whether it's the retention bonus and things of those nature, hoping that people have a short memory. But I can assure you that the people that I've spoken to in that field do not have a short memory.
I know out Petrolia Way there are some lawn signs that are popping up about sort of keep your hands off our public health care system,
Absolutely.
if you will. There's some obviously in other areas as well. Speak to that from an NDP standpoint as well.
Yeah, I believe some of those signs are the SEIU that are putting some of those up about privatizing healthcare, and certainly, I have friends who are in the nursing field, and they've seen some of this happen already, right? Where if you get hurt and all of a sudden, but if you have a lot of money, then you're able to get some of these services fairly quickly. But if people don't have money, then all of a sudden, hey, the wait for a PSW and in-home nurses and some of those things just aren't quite an option, right? And so we're seeing this privatization just sneak in just a little bit, and I think that's a very scary thing, and we're hearing that from people in the healthcare field, and those are the people who are saying we need to stop this. And I think we need to listen because those people are the experts in their field. So let's listen to them, right? And we need to support that field, and we need to make sure that people are treated the same in their health care, regardless of who they are, regardless of what money they have. People are people. Let's put people in front of dollars.
Right. Speaking of dollars, one of the things that people, all you have to do is go online anymore. I guess every day you see a picture with a new price as far as the gas prices are concerned.
Absolutely.
Gas prices, electricity rates, that sort of thing. What are the NDP plans moving forward?
Yeah, absolutely. I mean, big concern. Well, Liberals sold off Hydro One, so nobody was a fan of that at the time, and I think that's just come back even worse now. Also at the pumps right now, and it just feels like our government's not going to bat for us right now. It feels like Doug Ford wants to stay in the status quo. It feels like he's in the pocket of big business and special interest groups. Actually, like when we look at the average donation size to his campaign, it's $1,100. Right, $1,100 is not generally what the average person is able to donate to a political campaign, and I don't think you get that kind of money without owing people something. So to me, that says Doug Ford wants the status quo. He hasn't gone to bat for us. He hasn't tried to take on those big companies to stop gouging us at the pumps. Whereas the NDP absolutely would be taking these companies on and trying to figure out why we're getting gouged. Right? I mean, we've had in the past, price per barrel has been at where it's at now, and we weren't paying nearly the same price. So what's going on here? Like, we need somebody to stand up for the people, because people are, putting $100 into the tank like it's nothing nowadays.
Right,
that's absolutely crazy.
That's a normal occurrence anymore.
Yeah.
I could tell you from personal experience.
Yeah.
Long-term care, obviously, again, I saw a tweet the other day about almost 4,500 people have died over the past 2 years. Many of them seniors. I think 81% is the percentage I've read. Seniors that have died over the COVID period of time. What are the NDP plans moving forward to try to fix that problem, if that's the right way of putting it?
Great question, and this is another sort of on the top 5 list for people when I'm doing door to door. When we look at that 4,500 number, like that's per capita, that is very high in terms of death rates for anyone in the developed world for COVID. And that's scary, right? I mean, we're in Canada, we took a lot of public safety precautions for COVID, and we still had that happening. I think what that did is that showed, and what the pandemic showed is not things, it didn't break things, but it showed us the things that were already broken. So particularly in for-profit senior care, it showed us the corners that were being cut and the absolutely terrible conditions that people were having to live in. It showed us that our current government and the previous Liberal government before was putting money in front of people. So if we're going to take it down to a very simple level, the NDP is going to put people back in front of the dollars. We think that everybody deserves compassion and everybody deserves dignity, regardless of what walk of life they are, regardless of what stage in the life they are. So absolutely, we're planning on investing. We're going to take for-profit out of senior care, and we're going to put care back into it. What does that specifically look like? We're going to invest in PSWs. There's a big time staffing shortage in that field right now. So we're talking about hiring, up to about 30,000 PSWs. We're also talking about investing in their wages, increasing their wages, so that job retention is a little bit more. But we've heard from a lot of PSWs in the field that they need multiple jobs in order to just make ends meet. And that's not okay, right? I mean, these are the people that we're hoping are taking care of our parents and our grandparents and our aunts and uncles, our loved ones, right? So ultimately, an investment in these workers is also going to be an investment in outcomes in senior care. And again, getting rid of the for-profit system, because that very clearly has not worked, because big businesses and big companies are putting dollars and cents in front of people, and that has to stop.
Right. Home care, obviously some people would like to stay as long as they possibly can in their own homes, environments they're used to, and they know where all the nooks and crannies are and that sort of thing. How do we make that happen?
No, thanks for bringing that up. I probably should have mentioned that in my answer, but hiring all these additional PSWs is going to make it easier for people to stay in home longer. And we're hearing from people that can't quite afford the move yet and stuff like that. I mean, our plan is absolutely to help these people. We're trying to bridge the gap here a little bit, but absolutely the investment in PSWs is also going to include in-home care, because people want to stay in home, like you said. So certainly not forgetting about those people as well.
Right. Just a couple of minutes to go, but Ontario Disability benefits and so on, are we looking at an increase there as far as the NDP is concerned?
Yeah, absolutely. So, something that people don't realize, if you're a single person on OW, you're probably making about $638 a month. And the average rent for, a one-bedroom apartment in this town, you're probably looking between $1,000 and $1,100. So it doesn't, looking at the math there, it just doesn't make sense. On ODSP as well, I think a single person on ODSP, you're making around $1,140, somewhere in there. And again, if you're spending $1,100 on rent, that leaves you $40 for food and everything else. Like, again, these are the people who have been left behind and forgotten. So absolutely, the NDP's plan is to increase OW and ODSP by 20% immediately, and by year 2, the plan would be to double it, because people have been in legislated poverty. And again, I don't think people always understand that, but in my role as a social worker, I certainly see that on a regular basis. People have been legislated into this poverty. And our plan is to, again, increase it 20% in the first year, which is going to help people in the immediate, but doubling it to help people and support people get out of poverty. Because the plan is not to just have people continually on OW, but to support them, getting back on their feet. Okay.
Dylan Stelpstra, thank you so much for taking time to join us. I know we probably could have covered more territory, but that gives people a little flavor. And if they want more information, obviously you're online, you're on Facebook, that sort of thing. People can reach out, and if they have specific questions, and who knows, maybe you'll knock on their door as well.
Yeah, right? Absolutely. Yeah, thank you very much for the time. If people want to follow on social, Dylan Stelpstra NDP. We're also on Twitter, Instagram. The website is dylanstelpstra.ontariondp.ca.